Good morning to those who have joined us online, and good morning or good afternoon to all those who are going to see this presentation throughout Colorado and with other support groups in around the country. I had initially I had the name of this session up there. I think you're all joining because you're interested in us talking about a multidisciplinary approach to supporting kids with Tourette syndrome. That's what we're going to do today. We're going to be introducing to you, and I love this quotation. Woodson and Piacentini are two of the leaders in developing what you're going to be, if you don't know about it now, it's called CBIT, Comprehensive Behavioral Intervention for Tics. And you can see as they started to promote this around within the TA community around the country, they said, now that our collaborative research project has shown that CBIT can reduce severity. Now, this is a methodology that's non-pharmacological, which is why, hence the reference to multidisciplinary, that we can work closely with the Tourette Association. Interesting, I work with the Tourette Association, and the presenters you're going to see today are all employees of Children's Hospital Colorado, which is now embracing this methodology robustly. And it says, and we can establish training programs across the country. That's part of what we're doing today too. People will be able to use this who aren't with us today because it's going to be available online on our websites. And it's going to be available around the country for TAA to use to promote the concept of CBIT. We're very excited about what Children's Hospital has committed to doing. You're going to learn about that today. This presentation, I should acknowledge, is a grant from the National Tourette Association of America and CDC. CDC and TAA combine with CDC's money to produce a lot of wonderful, wonderful presentations and materials. If you've been on the TAA website, taa.org, you've seen their work. If you've gone on our website, coloradotaa.com, everything we use there, we steal from the TAA because their materials are so good, and we want to share them with our TA families in Colorado. This is also, we have this grant, and we said this is the first thing we're going to do as a collaborative annual event with the hospital and the Colorado TA organization. And you should know, because we're going to be talking about this collaboration has resulted in the establishment of a multidisciplinary Tic Clinic that Children's Hospital is endorsing. In fact, we had our 7th session with families yesterday. These are for patients within the Children's Hospital system who have seen a neurologist that get referred to the Tic Clinic, and they get assessed to see if perhaps a non-pharmacological approach to helping them manage their tics will work. And so the people that do that assessment are hospital employees, as well as have been trained and certified by the TAA to use this methodology. The presenters you're going to see today are the founding members of the Tic Clinic. And but it's important to note, and I represent TAA in Colorado, that there are a lot of families have already been supported and helped by the Tic Clinic, but I also work with other neurologists and other occupational therapists certified to deliver CBIT support. So that's an important message. We're here to support Colorado TS patients wherever they are. And if you're part of the hospital, you connect them. And if you need help in other ways, you contact me. And it comes up later at Denver TAA.org. And but if you've been on our website, you see that we both publicize this. We publicize a lot of other activities that the hospital and non-hospital are sponsoring. So we're here to do what that quote from those two leading practitioners said to do. Educate the world about CBIT. You're going to get a wonderful overview. Chelsea's going to talk about fundamental tics, to put us on the same page, understanding different type of tics when tics evolve into full Tourette's, and going to talk about an interesting phenomenon that you've probably heard about, functional tic-like movements that have confused the entire community of patients, of doctors, of therapists. So that's going to be a wonderful foundation. Kate's going to talk about CBIT. Kristen's going to talk about other things that the occupational therapist can do. And then any questions that we haven't had the time to answer, because there'll be a little bit of time after each presenter, we're going to save them all.